Um, and our time together is being powered by sacred.org. And we heard about them last week in terms of one of the very first collaboratives within the faith-based initiative of the city. And they're powering all of us by helping people connect to the resources in our city, so many good ones. So thank you to Sacred, because now we're recording all the time and those are going to be posted. And I don't have to fumble around in front of other people. So it's all good. I just wanted to take, I'm still watching for our folks who are going to be joining us. So I see Patrick's with us. This is good. Does anybody have any announcements? We haven't done that for a little bit. Something that might be coming up that we should be aware of.
And I have, this is Doug Beach, I have an announcement.
Go Doug.
Which is last week we sent out a save the date for Pathways to Hope this year, and it will be returning in person to the Tobin Center August 26th and 27th. We'll be opening registration probably in about a week, and we'll be sending out links so people can register online. Our keynote speaker this year is going to be Dr. Tom Insel, who's just written a book called Healing. I'm looking for my copy, it's someplace else, but Dr. Insel is the former director of the NIMH, National Institute of Mental Health. Great book, and the message is about healing community, about the part that community plays in healing people with mental health issues. So put that on your calendar. Again, it will be free. Going to have a great lineup, and we're excited to be coming back in person. Can't wait.
Thanks, Doug. And I want to tell everybody, if you've not been to this conference before, it's the best one. I think one of the best in San Antonio, and it's also going national this year. So we're going to be sharing our time with other cities and other people around the United States. You know, Doug, when you said that about community, it reminded me, so like this is the 7th year, but going back even into thought planning, back there earlier when we would talk, and I mean we as the big we would talk about holistic healing and care. It would be mind, body, and spirit. And then research revealed, you know, like you can get all of those things going pretty good, but if you're doing them by yourself, that it wasn't going to last long. And that the 4th component of holistic healing is community. And I remember we added that like to the subtitle. And here we've almost come, not full circle, but into fullness of circle into talking about, you know, how community helps heal and the healing of community itself. Yeah. So I know you work hard on that, and Doug's one of the earliest collaboratives that predates the faith-based initiative, because that Pathways to Hope, it's how it came about, community working together. So I see that we have Patrick and Breanna with us, so that's good. So we have our guest with us. Just as a reminder, and maybe to folks who are new here this week, weren't with us maybe last week, we're taking this summer to look at the community collaboratives that have formed within the faith-based initiative in one form or another over these last 5+ years, where they are today, how they might connect to other collaboratives. I think probably one of the interesting things to note about the community collaboratives is that they're each different, but they're all connected. They're kind of a spectrum of things, and they also evolve in different ways. So for example, last week with the San Antonio Community Resource Directory, sacred.org, it actually became its own standalone 501c3. Now, that doesn't surprise me, given that the community, you, me, all of us at the beginning of this said that it was the biggest gap that we had to help us do our work together was technology. So it doesn't surprise me, because the gap was so big, that this became, its own thing, because it was a gap. This week started as what we at the beginning called action teams, an action team on homeless and hunger. And they do, right, go together. But when you start to think about the size of both of those, as they started to evolve, and we're going to hear about those evolutions today and next week in terms of hunger, they went a different direction. And the direction that I kind of call what this collaborative went into is integration. So as things kind of started working together, I don't know how many times, and if Marjorie was here, but she's not feeling well this morning, but she would tell you, I don't know how many times we sat at tables and drew on whiteboards together, right? And we thought we knew where we were going, but I believe that the world showed us where we needed to go and how to work together. And so what's happened now, and we're going to hear more about that right now, is that homeless administration in the city works directly with the faith community and vice versa. So we no longer, I would say, have like an official homeless community collaborative. We have all those folks co-laboring together. So it's more integrated. And so Patrick Steck, who is Assistant Director in Department of Human Services, which is also where the initiative is based, is here with us today. And Breanna's with us as well. And Breanna kind of leads the effort on the ground. And so I want to welcome both of you with us. And I've got some questions for you and others while you're listening in and kind of getting this update. Feel free to put questions or comments into chat. And as you know, when we get closer to the end, we'll just open it up to conversation among us. So of the two we have with us, Patrick and Breanna, Patrick has been in this process longer. So Patrick, I'm going to go to you just for a little more historical question. I don't want to put Breanna on the spot, but so Patrick, over these so let's go just a little bit before the pandemic, but over these last years, if you could just kind of summarize a timeline in terms of how has the homeless outreach and engagement, how has that evolved in just really kind of basic steps?
Yeah, thanks, Anne. Thank you, everyone, for having us here. You explained it very well, and I was thinking this morning about it and about how we had whiteboard meetings, we had plans of where we were going to go, and then of course the pandemic showed us, and that's just the perfect way to put it. Is that with respect to outreach and connecting with unsheltered populations on the street, our community had a few outreach workers. Of course, people have been engaging probably with faith community or through nonprofits forever. But from that professional street outreach worker model, we didn't have that many full-time staff dedicated just to street outreach in San Antonio. We had a few, and we had one or two folks at DHS with the city. We had some nonprofits. But when the pandemic hit, we saw shelters close intake to new clients. We saw lots of changes in those first few months, thinking back. And so we started at the city, we had up to at 1.4 hubs was what we called them, resource hubs with meals, hygiene kits. We were doing COVID testing. When the vaccines became available later in the pandemic, we were doing vaccines. But in those early days, it started very much as an emergency response. And as we progressed through the pandemic, realized that these were really valuable to make connections with people, because at the San Fernando gym downtown, we were there every single day. And more people, more organizations quickly wanted to come there. Maybe not every day, maybe once a week, but a lot were joining us, and it became a real true resource hub. It became a place that we could easily and quickly connect people who wanted to help. They could come down and serve a meal, or they could get more engaged and deeper connection with that community. So that has evolved. We don't have our emergency response hubs anymore, but we do have in downtown, the Corazon Day Center is evolved from what they were doing pre-pandemic, and then came out on the other side of the pandemic as that day center now. At the same time, the city made more budget investments in street outreach, in those professional street outreach workers. So that's what Breanna's team is. Breanna's the manager for the Department of Human Services, of a street outreach worker in every council district, so 10 across the city. We've also funded our partner agencies like SAM and Centro and Corazon to hire even more of those street outreach workers. So we're covering the city better through that as well. And we're continuing to build that system, but that's kind of what it looks like over the last 2 years. It's grown by an order of magnitude as far as staff. And I think that we'll only continue to build connections with the community. And I think we'll probably talk about that in a minute.
I think it's so meaningful that you noted how more connections were made. That's one of the things that we're always leaning into in this work, is relationship and making those connections, and being able to see people as people, I'm going to go back just a little bit, because I do remember at one point there was one outreach person. I think that was in District 10, so that would be northeast-ish. And
Right.
What did that tell us? What was the value in that, which caused us to replicate across can you tell us that a little bit, Patrick?
Yeah, that was the first one. It was sort of a pilot project, the District 10 in you're right, the Northeast area. So it was in that geography alone. That was actually interesting. We didn't hire one person to cover all 600 something square miles of the city. It was a District 10 pilot. And what we were able to see from that was the importance of getting to know an area. The unsheltered population tends to stay in an area. I mean, they do move around, of course, but if you're able to repeatedly engage with the same person, that builds a relationship. I mean, that's the model of street outreach. We also saw through that first street outreach, it was a clinical coordinator, so a licensed clinical social worker. She was able to partner with SAPD, who is already out and kind of new encampments in the area, and built a strong relationship with SAPD safe officers to go out and engage with folks. So from that, the city saw value, other council members saw some value in that, and then city has a budget process where we kind of make these decisions every year of what to fund, and we made that funding decision. The council made that funding decision, but it was a vision of ours, and it's one of the key recommendations. We have the homeless strategic plan that our city did, but it's a community plan that's been adopted by SARA, the Continuum of Care Agency. So in that plan, street outreach is one of the key major recommendations. And so it aligned perfectly with that. We had this model of one geographic area. And so now Breanna's team, each of the team members is assigned to a council district. And of course they can overlap, they support each other, but they know an area They know a council, district staff, and the residents. I embarrassed myself once. I went to a District 3 meeting, and I introduced the District 3 street outreach member and said, he's here for your resource. Well, everyone there already knew him. He had already worked with all of the neighborhood associations. So everyone knew Daniel in that District 3 area. And so there's a lot of value in that too, in the education around the homeless response system. That's another key part of their job, and something that we're working to talk about what's going on in the community, what resources we have and what services, and just what this team is doing. So I'm grateful for this opportunity as well. But that is a part of their job as city employees, is to educate and engage with neighborhoods and the council district offices too.
It makes me think of how this kind of work, like before Haven, I mean, just in general, a lot of it was done like out of congregations, and still is, right? And into the streets, and then Haven came around, and there was this connection. But one of the gaps was a connection with kind of the street outreach that was happening and the city structure itself. So what this has developed, is another link in relationship. And so that community connection towards healing. I want to hear from Breanna. Breanna, tell us a little bit, if you would. One, how long you've been doing this with the city, but what the street outreach looks like, and what the hubs look like, because there are hubs now, right? That kind of went on. So tell us all about it, Breanna.
Absolutely. Good morning, everyone. My name is Breanna Jaijairam. As I was introduced, I am the Homeless Outreach Manager for the city's Department of Human Services. And as Patrick mentioned, we have a team of individuals who are each assigned to a council district and build relationship there. I've been with the city since September of 2021. Yeah, 2021. So just a little under a year. But I've been working in homeless services, specifically in street outreach, for about close to 9 years. So the work itself isn't new, but the community is. And so I'm really grateful to be here. As Anne mentioned, we do have some mobile hubs that have kind of popped up in the last year as well. Patrick mentioned Corazon, which is our day center. And so we wanted to take that model on the road, so to speak, in the various different districts. And so last October, we had a grand opening for Harper's Chapel in District 1, which is located at 1111 Lombrano, between near Zarzamora and Culebra. And there we have a hub every Wednesday. The city, we have a mobile shower through the city that we contract and provide services for at the hub. So we're there currently 10 to 12 because of the summer hours. We wanted to shorten it and make it a little bit earlier so it's not so hot for folks who are volunteering and coming out and spending time with our folks. So 10 to 12 every Wednesday at that location. And we bring employment services, street medicine services, partnering with the congregation who volunteers their time and collects donations of clothing. They partner with the San Antonio Food Bank for food, not only for the unhoused community, but for the housed constituents in that neighborhood. So they've done a wonderful job of integrating the work to serve everybody in the community, whether they're unhoused or housed. So that's been really, really important. We also have some treatment options through the San Antonio Fire Department Mobile Integrated Health Unit has access to Narcan and methadone treatment programs for folks. So they can make referrals at the hub for that as well. So that's been a wonderful partnership with Harper's Chapel Ministries. And then we recently started partnering with Jacob's Chapel here in District 2 at 406 South Polaris Street. And so there, we're just kind of getting our feet up under us, but they've been a great partner. We have the same, very similar services, but there's some other things that are needed in District 2 that might not be needed in District 1 and vice versa. So we try to customize the services that we bring or that we invite based on the needs of the folks presenting at the site and what entices them to come. And so that one is the first and third Thursday of every month from 10 a.m. to 12 p.m. as well with the mobile shower again. And then we also have been working with a barber school to have them come to both hubs because we'd like to offer folks a shower and a haircut, and hygiene and a haircut. So those are some of the things that we're doing in those locations at this time. We're always looking to expand and see where we can do this work in other districts, because it is incredibly important. As Patrick mentioned, this is a really mobile population. We know that they move around a lot. And so having a steady space where they can meet us is incredibly important to the continuity of their care with the homeless services. And so that's the beauty of the hub, is that every Wednesday they know they can find a street outreach worker at Harper's Chapel, right? So that part is really incredible about the hub work.
So I heard you say Harper's and Jacobs, but what about the one that's at Grace Lutheran? Aren't there 3 hubs?
Yes, and so Grace
Okay.
Lutheran is the Corazon Day Center. So that's the one Patrick mentioned, and that one is Monday through Friday. And so their hours, I believe their hours are shifting. They're supposed to confirm that later today, but they are Monday through Friday as a drop-in center. I think currently 10 to 4, but don't quote me on the hours. I can get that updated. But they do serve lunch, which is wonderful, a hot meal for folks there. They partner with CAM, Christian Assistance Ministry, which is right next door at 110 McCullough, for the mobile showers that they have at their site. And so they do wonderful, incredible work there as well. Very similar. Of course, that's an extension too of the Travis Park Church services that are taking place. So they also have their medical clinic I believe it's every Sunday, as a kind of a partnership with Corazon and that day center in Travis Park Church.
So it sounds to me like the outreach folks, which also work with volunteers.
Mhm.
So these aren't like solo folks
No.
going out there. It's a system of care. So it's about building relationships and connecting people then to their needs, providing for those needs either there at the hub or other connections where those needs can be met. Am I getting that kind of right?
Yes.
Yeah.
No, that's absolutely correct. Yes.
Okay, great. So either of you can jump in on the next one. So how could congregations and community groups and organizations that are out there, how can they help this effort? You know, like what are the needs of this work that's happening right now in terms of homeless outreach? What are those things?
Mhm. I think, well, of course, we would love to see this expand in other areas. So there's that piece. But I think, we can.
So are you saying you want to set up other hubs?
That's the end goal. Yeah, is to ensure we would like to see them in every district, one in every district at some point in the future, of course. And that would entail having more volunteers, because we can be there to kind of do the services and ensure that the shower gets set up. But then beyond that, we want to make sure that folks have a really positive experience at these hubs as well, and ensure that they have a human connection, whether it's with us in that moment or someone else, just to see how their day is going, right?
Mhm.
Engaging with them when they first show up, because we might be with another person. And so that piece is critically important.
So locations, are you in conversation? And you don't have to say which congregations or whatever, but are you in conversations with potential other hubs in districts?
Potentially in District 3 and in District 9. The other districts we haven't had any connections yet, but that is something that we're working on at this time.
Okay. So if a congregation wanted to talk to you about being a location, should they talk to you, or who should they call?
Yeah, they can call me, and then Marjorie and I would work together to kind of set up a site visit and ensure that, because there's a lot. The other piece of this is that there is a lot of community outreach that all of the current hubs have done to ensure that folks in the community know what this is and what it is not, and how often it'll be happening and things like that. Because sometimes there's some fear in bringing this into a community, and so the education piece is critically important. And I think that's the piece that we can help with. And kind of talking through what that might look like in your community.
And now I'll stop this line of questioning, but if there's already a hub, so we know in District 1 and District 2, but if there was another congregation in District 1 who wanted to do this, could they still call you just because there is one? Is that going to stop from opening another one?
So I
What do
think
you think?
Yeah, so I think right now the challenge is capacity on the outreach team in terms of being able to set up the shower and things like that. However, what I will say is that we are all about partnership, and so I wouldn't turn anybody away. I would figure out how to kind of maybe integrate what's already happening and see how we can partner in that space. And always potential in the future to expand, but I'm also mindful of the team's capacity as well.
Okay. So now, what else can congregations do to help besides location?
Yeah, I would say volunteering at any of the locations that we currently have. I know Corazon, which is at Grace Lutheran Church, the day center, is always, looking for groups to volunteer for various different, whether it's serving meals or whatever the case may be. That's wonderful. I'm trying to think, Patrick, is there anything else? I know there's more.
Yeah, I think, well, one thing that I've heard from our street outreach team is sometimes just a safe location. And that's what our hubs can be. But, I think if your congregation is not ready to commit to a full every week or every other week, that's too much, because it is a lot, and we want to make sure it's sustainable and predictable for our clients. But if they can offer a safe space, maybe a room or something that a street outreach worker can say, "Hey, can you meet me here on Tuesday to go through an assessment," or something like that, those could be helpful for us. I mean, there are community centers, a library, or things like that. But if you have a church door that could be a safe place, and it could be a moment for the congregation to engage as well. But those lighter touch kinds of things, that's another thing to explore. I think again, reaching out to Breanna and Marjorie to talk about that is helpful, because we do hear that a lot. Like, meeting on the street corner may not be ideal if you're going to have an hour conversation about something. You want, right now, at least some air conditioning and a chair. So maybe that's an idea as well to contact Breanna.
But it also makes me think of like Christ Episcopal Church. And maybe this is one thing we could do, but like Christ Episcopal Church have what they call Sidewalk Saturdays, where they open up and it's just a beautiful thing that they're doing. Food and clothing and relationship building. Maybe one thing that would be really helpful is knowing what is going on, out there in different congregations. And so that outreach workers know that they have other resources like that, where people are doing the work already. So maybe that's something that we can look at doing. I'm going to pause for a minute at 8. It's 8:28, and I'm hoping that at least one of you maybe can stay on for another 15 minutes. And I also noticed, it doesn't surprise me, but Beverly has her hand up, so we're going to have some questions. But we promise folks that we'll try to get to the meat of the conversation, which I think we've done quite a bit of, by 8:30, in case people need to move on. So for those who need to move on to another meeting at 8:30, thank you for being with us today. And next week, we will be looking at hunger, food. And so we're going to be hopefully hearing from the food bank and how that homeless and hunger action team, original one from 5+ years ago, has just really grown and developed. So thank you for being with us today. Breanna, Patrick, one of you able to stay for a little bit longer? Yeah. Oh, good. So I'm going to ask one more question, and then we're going to go to take hands and questions on the screen. And this one might be for Patrick, but Breanna, I don't know. You can answer too. So over the years, in terms of like your experience from like the city or where you were working and doing this kind of work, and then working with congregations, in partnering to do the work. How has that grown relationally? My real question is your comfort level with it over the years. Can you say something to that? Patrick, you're muted.
There I go.
There.
Okay. Yeah, I mean, I think we recognize it's always been very important, and will continue to be. I mean, it is such a source of goodwill and compassion in the community to gather together, which is what, that's your job, Anne, I know, every day. But I think that recognizing that and really engaging with that faith community in settings like this, in the work group of years ago, whatever it comes to in the future, I think that's very, very important. And so I just appreciate this opportunity. We want, what I will say is, we have, even in the street outreach, the organizations that we fund, everyone does it a little bit differently, and every church or congregation or other nonprofit will do things a little bit differently as well. And I think that we need all of those kinds of outreach, all of those approaches and ways of doing things, because everyone out on the street living unsheltered has their own story and may engage or respond differently or better to someone else. So I think harnessing all of those efforts with a common goal, of course, of getting folks to the right service or the right shelter or the right housing program. If we can kind of row together, that's the win for the community. So I think it's been good, and I think it can only improve that relationship that you're asking about.
Mm-hmm. But at least from my vantage point, you look a little bit more comfortable at it, Patrick, and you just get, people just roll up their sleeves, which is a wonderful thing in this dominant culture of separation of church and state, where we're kind of uncertain. How do we do this thing? Well, when it comes to helping people, we just do it, right? So I'm so glad that's changed a bit. I'm just going to go back to Beverly. She had her hand up, but maybe her question was answered. And so here she turned on her mic. I can see that. Beverly, do you still have a question?
I did. Patrick, I applaud the work. It's watching San Antonio grow. We were, West Care was fortunate enough to be one of the recipients of the Amazon Amazon gifts for the homeless project for what we do in California. And it was, these are one of the things that we do. And one of the things that I was just visiting with my colleague in California was about, in terms of community trust and being able to bring the community along in terms of recognizing it's not a we, they. The people that we're helping are us. It is us. And so one of the things I just wanted to be able to say with the permanent supportive housing, I know the newspaper quoted you, and it really, this past week, and it has actually stirred a lot of action, that, to kind of a call to arms. And so one of the things I would hope that you all would consider, working with the Town Trend Project, we're looking at that permanent supportive housing project. And we really do hope that we can help convince the city that instead of doing something new, that you can add on to something that's right out, literally less than a mile down the street. I think that might be a great win-win. And Town Twin is open. They already have the land. We can actually leverage. This is the kind of collaboratives, and the thing that Ann sent out is community collaboratives. And so you have an organization that's already bought the land, already acquired it, is already building, and can just go vertical and accommodate the people that you guys were thinking of putting into that Garden Inn hotel. And it will be a win for the city, a win for the community, and a win for Town Twin. And I just hope that you guys will really consider that as a true collaboration it's going to be really great for the community. And we finally will turn the tide and help people see that this is a problem that we can resolve, that we can solve, and solve it well when we all are rowing in one direction.
Thanks, Beverly. Go
Yeah,
ahead,
and
Patrick.
you're right. I think we will certainly consider that. I understand. I understand that sentiment. I think it does make sense, and it's definitely something we should consider. And I think this kind of answers. I saw Susan's question in the chat. You know, what else can we be doing? And and what Beverly, thank you for bringing up, is permanent supportive housing. Housing was going to be my answer of all kinds. So we have the housing bond that the city's voters just approved last month. That is part of a larger strategy of building housing that can be affordable and accessible for more people in our community, because that's really one of the best homeless strategies is to prevent homelessness from even happening by making housing affordable in the first place. But for people who are experiencing homelessness, and especially if they have been on the street for a long time, if they're considered chronically unsheltered, there is an intervention of affordable housing, deeply affordable housing with supportive services. So the city's looking to build more of those units. We have some in different what we call scattered, across the community, where it's in a typical maybe apartment or duplex that someone is getting supportive services, but bringing it together so all these services are on site for this population is a model that's worked well in other communities and something that we want to develop more of here in San Antonio. So the Garden Inn is a proposal, but Town Twin Village is a terrific new organization. They got lumber on their site. They're building right now. So these units are going up. And so the city has funded that organization already, but potentially funding them to do more there, because we know we have that great need. And so thank you, Beverly. I really appreciate bringing that up. And we will be considering that deeper partnership with them as well.
Thanks, Patrick. I wanted to mention that Patrick also put a link in chat so that you can go to the homeless strategy if you aren't familiar with it and want to read it. Stephen, thanks for being so patient. Your hand's up. Let's hear what you got.
Thank you so much. And I appreciate the interfaith service comments about homelessness. I hope that the rapid response team protocol does become available to other organizations, and even in a crisis situation can be mobilized quickly, to prevent homelessness. But I wanted to also point out that Woodlawn Point is having their interfaith service, which will be the 19th, and that Woodlawn Point is on behalf of Rainbow Seniors going to have a nutrition center. So I think this kind of rapid response team would be an excellent resource for those nutrition centers that provide to seniors, and also can do referrals in other regards. Thank you.
Thanks, Stephen. That's good stuff to hear. Doug has a question, and I'm going to add to the question, but his is, what connection does the city's homeless program to mental health care for people who you're in contact with? More specifically, I'd like to hear what that connection is with the city's homeless program and Bridges to Care.
Yeah, so I can take that question. So we do have licensed professional counselors and licensed social workers on our team. So there's that connection where if one of our non-licensed staff comes into contact with someone who may be experiencing a mental health crisis or symptoms of mental health, we can partner with the clinician and have them go out and assess the situation. We do also partner with CHCS, the Center for Healthcare Services, at Havens campus and at their other clinics to engage folks in mental health care. PATH is one of the programs through CHCS where they're mobile. They can come out in the field with us to meet clients where they're at. in the event that our clinicians can't connect them to care. So that's what we have at the street level. We do work closely with the hospitals as well in terms of discharge, and then SAPD if there needs to be, a mental health hold placed, if that's deemed necessary, that would be who we would call for that. In terms of bridges to care, I know we're working with y'all on training some of our staff on trauma-informed care and self-care and burnout and kind of what that looks like as the, the conduit to folks experiencing homelessness and the trauma that they experience, and then the second-hand trauma that potentially outreach experiences, right? So that's taking place. And then I think there's still opportunity for us to grow throughout the city in terms of connecting the folks that we're serving with Bridges to Care and vice versa, those partners with our team and figuring out the best ways to collaborate as we move forward.
Good. Other thoughts and questions by folks? I think maybe I've gotten everything in chat. Have I? Yes. I do see that Breanna put her email as well as her phone number. It looks like her cell phone number there. So that's her probably most direct number. Any other last thoughts? I have a couple, but I want to make sure we get to everybody's. Mine is, I really have one thought, and my thought is gratitude. So I'm just, it's a big grateful. I'm grateful for the work that has grown and developed out of Department of Human Services and Homeless Administration. I'm grateful for the fact that it's so and has become so relationship oriented and less, transactional, like how do we move from one place to another place, but, people, how do we connect? I'm grateful that congregations are stepping up and volunteers. It's so good to see that. I'm grateful that I see so much more in terms of connection with Bridges to Care. So I'm kind of grateful for that vision down the road as well. And I'm grateful for, the decisions that our city council and staff have decided and rolling up their sleeves this way and saying yes to budget on behalf of all of us. So yeah, gratitude is my thing. I'm just grateful. We've come a long way. I can see it. And I think that's one of the biggest benefits of this kind of work. If in your lifetime, so this comes from my own vantage point in my own life, if we have the gift in our lifetimes of being able to actually see where the work has come full circle, like to actually see the benefit, to see the growth and development, that is a real gift. We don't always get to see our work, and we have a long ways yet to go. But I always talk about that as the benefits package. It's just such a great joy to be able to see the work. And so, and we're all sitting here. So we've all, whether we've been aware of it or not, there has been transformation and there's been change, and we are in a better place than we were a year ago, than we were 2 years ago. And 20 years ago, we could just keep going back and telling history. So thank you both, Patrick and Breanna, for being with us this morning and for your leadership and your stick-to-itiveness. It's just so great to have you leading this. Thank you all. Have great weekends, and I'll see you next week at the intersection.